Hi, my name is Heather. I'm from the U of R Home Infusion Pharmacy. Here today to go over how to do the infusion for the home pump ball for your antibiotics. This is how you want to set your things up. So we have your 2 salines out and your antibiotic. This is going to be stored in the refrigerator, and you'll take this out about 2 to 3 hours before you hook up. You want to scrub the area down first that you're working on before you set your things out, and also wash your hands with either hand sanitizer or soap and water. Normally there's some tape on the end that kind of holds the tubing together. You're going to rip that paper tape off of there, and you're going to examine the label that's on here that should have the correct name and date of birth on that. So you just want to double check that it's yours. So we're all ready to get started. We're going to take our alcohol pads and open those up. And then we're going to take the alcohol cap off the end. It's a one-time use, so you're going to just throw that out after you take it off. And we're going to scrub the hub for 15 seconds. Okay, we're going to take our first saline and twist that cap off of there. And you're going to pull down on your plunger just to move it down, and then push up. We're going to push in and twist onto the hub or the needleless connector, and we're going to open up this clamp. We're going to do a push pause to flush. And this is a really important step for the push pause because that's going to create a little turbulence in there to help clean the sides of the line to prevent clotting. We're going to twist this off the end. And we're going to take the next alcohol pad. And we're going to scrub again 15 seconds. Okay. So the first thing we want to do here when we're all ready to hook up to this pump is we need to open up the clamp. There's sometimes an indentation where the clamp is because these are strong clamps. You're just going to roll that between your fingers if you see any indentation. And then we're going to remove the cap from the end, and we're going to wait for a drip. Here's our drip. Now I'm going to attach. Push in and twist. Okay. So this will infuse for you for the amount of time that is set as far as how much is in your pump, usually an hour to an hour and a half, sometimes 2 hours. So you're going to let that infuse, and you can carry it around in your little pouch that's provided for you. As this infuses, it gets a little bit smaller, the inside starts to deflate, and then when it's empty, they look like this. Okay. So when your infusion is complete, you're going to wash your hands again. We're going to close the clamp on your pump just in case there's some more fluid in there. And then we're going to remove it from the end of your line. And that'll be garbage. Now we're going to scrub the hub again. And we're going to clean with your last saline. Twist the cap off. Pull down and push the air out. Push in and twist, and push pause again. So when we get to the very end of your saline, we're going to clamp the line right away, and that's going to help lock some pressure in and prevent clotting on the inside of the line. And then remove. And then we have an alcohol cap that we can put on the end. So just put your line right in there, push in, twist, and pull this cap off. And that's your antibiotic infusion.